One axiom that has proven to be true over and over again is that the only constant in life is change. This year especially seems to hold that saying true. So much has changed since our forum last year in the world, in our industry, and even in my own life. COVID-19 has left an indelible mark on our world, which will forever change many facets of our society. More specifically in healthcare, COVID-19 has thrust telehealth center stage, making it clear that virtual care will be systemically integrated into care delivery from now on. On a personal note, InTouch Health has joined forces with Teladoc Health, and in this transition, my new role moving forward has also changed. I no longer have operational responsibility of an organization, but can now leverage my experience in telehealth, healthcare in general, and technology to contribute to the advancement of healthcare in our global society. My new job title is Teladoc Health Fellow, which is one I'm very excited about. This year's forum, our 14th annual Telehealth Innovation Forum, has also changed. I know many of you have attended our previous forums, and thank you again for your attendance this year, albeit virtually. For many of you, this will be your first time at our forum, for which I thank you for deciding to spend this time with us. In past years, I would stand on stage and present a vision on the future of virtual care through the lens of technological advancement. This year, given all of my personal changes, I've decided to do something different. I'd like to present an idea I've been thinking about for many years and working on for the past few on how we can leverage telehealth technology that's already in place around the world to alter and potentially solve one of society's most significant problems, global access to healthcare. And when I say global access, I include the half of the world's population which doesn't have access to care today. But before presenting the solution, let me take you through my thought process. A couple of decades ago, one of my mentors, Bill Williams, explained to me the progression of one's professional career. He broke it down into 3 phases. The first typically begins right after completing school. He calls it the survival phase. We finished our education and are now trying to apply that education to find a good job that pays us enough money to support our needs. If we're fortunate, over the coming years, and sometimes many coming years, we make it to the next phase, which he called success. During the success phase, we're doing well enough in our careers to become financially comfortable. We're hopefully also having success professionally with regards to responsibility and impact within our organizations. This is a great place to stay throughout the end of one's career. Bill told me, however, if you're successful and you're so inclined, you can strive for the final stage, which he called significance. We're not all fortunate enough to have the opportunity to focus on significance, nor are many of us inclined to do so. However, for those who are willing, the significance phase is all about how to make a positive difference in the world without regard for any financial return. Although Bill was speaking to me about these 3 phases in the context of one's professional evolution, I believe these same phases can be applied to nascent industries as they mature. When I entered the field of telehealth in 2001, telemedicine was clearly in survival mode. Doctors would say, "My patients won't like this." Health system administrators would say, "This violates any number of laws." And the health insurance companies would say, "I'm not going to reimburse for this." We had to overcome significant barriers to show that ultimately telehealth is the pathway to improved access to care for the patient, for better quality medicine, and to lower overall costs. Many pioneers contributed to this movement. InTouch Health, together with many of you, developed Telestroke as an early use case, which demonstrated that telehealth can be used to improve patient outcomes and lower costs. Teladoc Health, working with health insurance companies and employers, developed a variety of low acuity use cases which enabled more convenient access to care for patients and lowered overall total costs. Over the last decade, the number of use cases expanded greatly. into areas like behavioral health, critical care, neonatology, cardiology, and more, and was continuing to grow very nicely. Then COVID-19 happened. While we hate that it took a global pandemic to encourage widespread adoption of this technology, we have seen the popularity of telehealth spike. In 5 months, what might have taken another 5 or more years. And what was once unimaginable just a few months ago, federal reimbursement, triple-digit physician and patient adoption, a comprehensive embracing of the virtual first mentality has now arrived. Everyone, be they patients or providers, now knows of telehealth and are using it. Telemedicine is now here to stay, and it is universal. Telehealth has now entered the success phase of its journey. Now, before I continue, I'd like to take a moment to let all of that sink in. It took so much work from so many of you, where you were sometimes even shunned or ridiculed by your peers along the way. And I want to congratulate you and thank you for those of you who have lended a hand in moving telehealth from the survival to the success phase. It was your determination and belief that this technology offers us a better way to provide easier access to quality care at a lower cost, which has finally won out. Now that telehealth has entered its success phase, the question is there a way to make this technology significant? And I would suggest that there is. Another significant influence the COVID-19 pandemic has taught us is how connected we really all are. The health of citizens in China directly impacts citizens in Italy, which impacts Japan, and then us here in the US. There are no geographic or societal boundaries for viruses or health. We have also learned how necessary proper preparation can be, as well as the negative consequences of being caught off guard. The global healthcare economy is split into 2 spheres. There's one sphere where we have the means to pay for our healthcare. This includes countries like the US, where we have the resources to pay for the healthcare we receive. And then there's the other sphere where they don't have the infrastructure, the expertise, nor the funds to offer their people health care. The WHO says that the developed world spends about $3,000 per person per year for their health care. In the US, we spend more than $10,000 per person per year. Whereas by contrast, the underdeveloped world spends about $41 per person per year, a difference of more than 70 times. This disparity has been known for a long time. We have organizations, nonprofits, missions that are trying to rectify this massive gap between the 2 spheres. In fact, donor spending represents such an essential source for the low-income nations' health spending that it accounts for more than 25% of their whole healthcare spend. Even though these missions are helpful, they barely make a dent in the problem, and they're unsustainable. It takes significant time and money to fly volunteer healthcare workers to the underserved communities to provide care for only a week or 2 and then to leave. This helps only a small percentage of the underserved population for only a short amount of time. That methodology is high cost and low impact. Underdeveloped community healthcare needs require more resources than the current strategies can deliver, so I'd like to offer a better way. Telemedicine has been the missing piece of a solution for creating a sustainable, affordable, and adequate healthcare model for those who live in the underdeveloped countries. It allows cost-effective, easy to deploy, and easy to scale healthcare. As I've been entering the significance phase of my own professional career, I've been working on such a solution for the past 3 years. I helped found a nonprofit organization, World Telehealth Initiative, or WTI, that uses telemedicine and volunteer clinicians to provide health care to the less fortunate half of the world. We now have hundreds of globally based physicians volunteering in dozens of underprivileged communities around the world for a variety of use cases. For example, one of the locations WTI is operating in is Lilongwe, Malawi. According to the World Bank, the United States has a doctor-to-population ratio of about 1 to 400. On the other end of the spectrum, Malawi, in Eastern Africa, has a ratio closer to 1 to 55,000. Their specialist ratio is far worse. There are fewer than 10 trained obstetrician gynecologists for a population of 15 million. In Malawi, WTI is assisting Freedom from Fistula Foundation and Texas Children's Hospital to repair obstetric fistulas in women surgically. In nations with easier access to clinical assistance, these fistulas are a rare occurrence, as routine procedures such as cesarean sections erase these complications. One of the hundreds of women treated in Malawi's clinic was Esperanza, a 19-year-old expectant mother who had been traveling 6 hours while in labor on the back of a bicycle to reach the clinic. After days of prolonged obstructed labor, Esperanza suffered a stillbirth and unfortunately did not go home with a baby, but returned home with a fistula, leaking urine and feces indefinitely. Women suffering from fistula complications often become socially isolated. This fate might have left Esperanza shunned if it weren't for WTI's telemedicine clinic. Here, Dr. Jeff Wilkinson of Texas Children's Hospital and Baylor College of Medicine was able to consult with the local surgeon to guide her through the complicated double fistula surgery. Thankfully, Esperanza was able to recover and avoid becoming one of the millions of women who suffered for years or even decades from untreated fistulas. The experience working with World Telehealth Initiative has taught me that we need 3 things to have a successful program: motivated clinical resources, available telehealth technology, and appropriate funding. In my experience, I have learned over and over again that most doctors inherently have a high desire to help the underserved. The most motivated ones already selflessly donate their time and money to travel to places that need them most. Telemedicine enables this group of doctors the ability to help their chosen underserved communities continuously, not just when they can afford to travel there. On top of that, roughly 28% of U.S. doctors are foreign-born, many of whom immigrated from less developed societies. These doctors often feel a responsibility to help their native homelands, but have not had the way or means to do so. They are unable to afford the time and expenses of traveling to these under-resourced communities. Now we have a way. Thanks to telemedicine, doctors can volunteer simply by sitting in their living room for an hour or so, periodically, and perform valuable consults in any place in the world, helping the underserved with their healthcare needs. What we have found is that there's no shortage of clinicians wanting to help others in this way. To solve the technology problem, World Telehealth Initiative leverages donated telehealth technology from InTouch Health, now Teladoc Health, to connect remote physicians to these locations. It turns out that in these low-resource communities, they generally have access to basic internet connectivity and electricity, which is all that our telehealth technology requires. During the transition of InTouch to becoming part of Teladoc Health, the leadership at Teladoc learned about World Telehealth Initiative. And to my excitement, as a fellow at Teladoc Health, they are empowering me to continue this mission and use Teladoc resources to help drive this initiative forward. Teladoc Health has decided to make the World Telehealth Initiative part of its Corporate Social Responsibility, or CSR, program. Although the CSR concept has been around for many decades, in recent years it has become a real focus to many corporate stakeholders like their customers, employees, and shareholders. Today, companies are more focused than ever on improving their carbon footprint, their waste management, their diversity, and their philanthropy. However, at Teladoc Health, we're working to take this to yet one level higher, and that is to focus on solving a significant societal problem which we're exceptionally well positioned to address: global access to healthcare. As you can imagine, I'm very excited about this. The last component to solving the WTI's Global Access to Healthcare initiative is funding. I'll be working hard to solve this and have already received commitments from Telehealth and other foundations and individuals passionate about our mission. Fortunately, in our case, we have volunteer doctors and free access to telemedicine technology, so relatively small funding creates tremendous leverage and impact. All this is to say, we can fulfill all three requirements: healthcare expertise, telemedicine technology, and funding to create a genuinely significant future for global health. This is one of those rare instances where a relatively small but focused effort can create massive benefit. This perfect storm reminds me of a book called Empires of Light, which talks about Thomas Edison, Tesla, and Westinghouse and their race to electrify the world. In one segment of the book, it talks about harnessing the power of Niagara Falls with generators to create electricity. These falls generate power for about a quarter of New York City and Ontario. These falls were already flowing well before their power was being harnessed for electricity, and once harnessed, it took minimal effort to power much of the entire Northeast community continually. It's almost like getting something for nothing. A global telemedicine network is already being built and paid for by the developed world. With a minimal additional load on this network and the altruism of clinicians from around the world, we can use the same network to enable the delivery of care to the underserved half of the world. There's still much work to be done. For example, as World Telehealth Initiative scales, we need to develop an automated matching algorithm that matches volunteer clinicians to the right underserved community. This involves many variables like clinical expertise, time zones, language barriers, culture, personal preferences, etc. However, these challenges are solvable, and the global goodwill created from this effort will make all of this work worth it. This won't happen with a flick of a switch, but the majority of the framework is already in place, and we're almost ready to turn on the lights. According to a PricewaterhouseCoopers report, more than half of U.S. physicians, which is around 500,000 doctors, already have or will soon adopt virtual care technology to treat their patients. This number will surely be higher in the post-COVID world. If each of these physicians is willing to donate 1 hour a week to seeing patients in vulnerable communities like Lilongwe, Malawi, that will aggregate to 26 million hours a year. The average virtual consult takes about 10 to 15 minutes, meaning we can treat over 100 million patients per year. That's 100 million people like Esperanza. As we now know, the future of healthcare delivery will include telemedicine. Patients expect the convenience of it, and there are too few physicians to continue our previous course. The simple truth is that there are people in this world who get healthcare and can pay for it. And then there are those who just can't afford healthcare. However, adequate, cost-effective healthcare to the global population at large, while negligibly increasing overall global societal cost, is within our reach. I've been fortunate in my career to now have the privilege of focusing my time and effort on what I believe to be significant. I've had the opportunity to journey together with many of you in the evolution of telehealth from survival to success. I believe we can now continue to drive the success of telemedicine in the developed world, yet also use telehealth to create significance by using it to provide care for the underdeveloped world, creating truly global access to healthcare. Thank you so much.